All About Acid Reflux Acid reflux is scientifically known as gastroesophageal reflux disease, GERD. It is a disease characterized by the abnormal reflux of gastric contents into the esophagus resulting in chronic symptoms or mucosal damage. Thanks for watching. Welcome to Master Health Media Channel. Subscribe, make a comment, hit the bell icon, please, and thanks. Acid reflux is often caused by temporary or permanent alterations in the lining that separates the esophagus and the stomach. Ineffectiveness of the lower esophageal sphincter, less, or a temporary less relaxation connected with a hiatal hernia is just one of the common causes of acid reflux. The process can also lead to a backflow of gastric juices to the pharynx or mouth. Among adults, the most common symptom of acid reflux is heartburn, which is caused by the presence of acid in the esophagus. Heartburn is characterized by a painful burning sensation behind the sternum or breastbone. Another symptom or manifestation of acid reflux is esophagitis, which is characterized by an inflammation of the lining of the esophagus, which is also known as the mucosal lining. Esophagitis also causes swallowing difficulties and chronic pains in the chest area. Sometimes, individuals suffering from acid reflux may also experience coughing, persistent pain in the ears, hoarseness or a change in the voice, and even sinusitis. If acid reflux gets complicated, it may lead to the formation of a stricture or ulcers in the esophagus. It may also lead to a condition called Barrett's esophagus and, in worst cases, to cancer of the esophagus. It doesn't mean, however, that a person who regularly suffers from heartburn is suffering from acid reflux. By all means, the heartburn may be from other causes. But if a person suffers from heartburn more than once a week, then he or she is at risk of acquiring acid reflux. Persons with hiatal hernias are also at a greater risk of developing acid reflux than those who are not. The pain felt by persons suffering from heartburn is caused by the reflux of acid contents from the stomach to the esophagus. Pain in the chest area coming upwards the mouth. Persons suffering from acid reflux may also experience tasting something sour or salty behind their throat. This is caused by regurgitation. This sour and salty taste may persist even without heartburn. Other less common symptoms of acid reflux include difficulty swallowing, chest pain, halitosis or bad breath, repeated throat clearing, and water brash or hypersecretion of saliva. The symptoms of acid reflux in children are also the same as those in adults. Acid reflux in children may manifest in frequent spitting, throwing up repeatedly, coughing, and other respiratory problems. Children suffering from acid reflux may also experience weight loss, frequent crying, loss of appetite, and bad breath. Parents must remember, though, that children may show one or many symptoms. There is no one symptom that is always present in children with acid reflux. The cause of acid reflux in children, especially in babies, is their immature digestive system. This is why infants stop having acid reflux when they reach the first year of age. However, some children do not outgrow acid reflux. Some continue to suffer from the disease up to the teen years. The best thing to do for parents of children suffering from acid reflux is to take the children to the doctor as soon as possible to avoid any complications. Acid reflux is made up of chronic symptoms and/or mucosal damage that are caused by the abnormal reflux of stomach contents, namely the powerful stomach acid. When the gastric contents are expelled into the esophagus, this creates discomfort, pain, and possibly lasting tissue damage. Sometimes acid reflux is a physical problem, where the lower esophageal sphincter does not effectively contain the contents of the stomach, and in some cases where a hiatal hernia is a factor. The most common symptom and complaint of those suffering from acid reflux is heartburn, which feels like a burning, stinging, or even ripping type of pain around the breastbone area. Other symptoms include difficulty swallowing and changes in mucosal linings of the throat. In extreme cases, sufferers may develop esophageal ulcers or scarring. In order to diagnose the condition, patients may be given a barium mixture to drink. This will help show the structure of the esophagus, sphincters, and stomach in order to determine a good course of treatment. Sometimes endoscopy is used to better examine the esophagus, stomach, and relating portions of the body. The patient will usually be sedated in order to ease relaxation. No matter which course of treatment you and your doctor decide to pursue, there are many types of food that tend to be more likely to trigger acid reflux symptoms. Avoiding or decreasing your intake of these foods may help to alleviate the situation. Acidic, fatty, and spicy foods tend to promote gastroesophageal reflux. Coffee, alcohol, vitamin C and calcium supplements are gastric acid stimulants. If you ingest these things, it is best to do so during the day or periods of increased activity. Just before bedtime would be the worst time. Chocolate and peppermint, onions, cabbage, broccoli, cauliflower, and Brussels sprouts are known acid reflux stimulants. Milk and dairy items should be avoided at bedtime. Eating smaller meals, elevating the head of your bed, and drinking more water have all been shown to have good effects for coping with and managing acid reflux and related conditions. Though there are a number of heartburn medications on the market, I strongly advise you to find simple solutions, such as avoiding certain foods, before you start medicating the problem. When we treat the symptoms of a disease and do nothing for the underlying causes, it's only a matter of time before the condition has additional symptoms. So let's work with our bodies and do our best to ingest foods that help us and avoid ones that exacerbate our various conditions or concern areas. Start eating a little healthier, and chances are you'll notice a difference for the better, no matter how mild or severe your version of acid reflux is. Thanks for watching. Welcome to Master Health Media Channel. Subscribe, make a comment, hit the bell icon, please, and thanks. Blessings.